So guys, I'm talking about mixed gallstones. Mixed gallstones is basically from the types of gallstones that we have. So the main types of gallstones is what the cholesterol stones and the pigment stones. So if you have cholesterols mixing up with pigment to form stones, that's what we call what a mixed stones. Okay, so these stones are not purely cholesterol types, and they are not purely pigment types. Okay, so you have a mixed type of stones causing an obstruction in the gallbladder or the bile duct. Okay, so talking about these mixed stones, we'll just be talking about the characteristics, or we're talking about the risk factors to developing mixed stones. We'll talk about the symptoms. I'll talk about the possible treatment for mixed stones. Okay, so mixed stones are a type of gallstones that contains a combination of what? Cholesterol, bilirubin, calcium salts. Okay, and they are actually the most common type of gallstones, accounting for about what? 80% of all gallstones. Okay, so most gallstones you find them mixed up. Right? So composition. Mixed stones are contain a mixture of what? Cholesterol about 50 to 70%, bilirubin about 20 to 40%, calcium salt about what? 5 to 10%. Alright? Then appearance. Mixed stones are usually what? Brownish or yellowish in coloration. Okay? They are irregular in shape. If you see here, this one has flat faces. This one also have a definite shape, but this one, the shape is kind of like irregular. All right, so they are also variable in size. Formation, that's when mixed stones are formed. That's when bile becomes supersaturated with cholesterol and bilirubin. You find these mixed stones. All right, nucleation occurs. Okay, this will allow crystals to form. Okay, that's when bile becomes supersaturated. Then stones can grow and accumulate over time. That's why it's always good to diagnose all these conditions from the early stages and all that, right? And talking about the risk factors, what are some things that can make it much more easier for you to develop these mixed stones? Okay, it could be family history, like it is from you guys' genetics. People from your family suffer from the similar condition, all right? Then it could be obesity, it could be diabetes, it could be some high fat diet, it could be low fiber diet. Okay, it could be certain medications like what? If you are taking some estrogen, progesterone, that predispose you to developing mixed gallstones. If you have a liver disease, there's a chance for this. Okay, if you have an infection in the biliary tract, there's a chance for that. All right, then talking about the symptoms, if you have these mixed stones, all right, mixed stones could lead to what? Abdominal pain, nausea and vomiting, fever, jaundice, that's yellow coloration of the skin and eyes, dark urine, and pale stools. Okay, then talking about the treatment. Okay, if it is still asymptomatic, it's not really causing much problems, you can just do some watchful waiting. Okay, just wait, observe, be patient. All right, they could do some medications just to dissolve the stones, like what? Usodiol. All right, they could do some surgery like laparoscopic cholecystectomy. They could also do some endoscopic retrograde what? Cholangiopancreatography, just for stone removal. All right, so guys, that's it about mixed stones, basically talking about the characteristics, risk factors, symptoms, and possible treatment for it. All right, that's it.